All right. Hi, everyone. Thank you for joining our webinar session today. Today, our topic is to talk about medical radiation science programs, our joint University of Toronto programs. So my name is Cherry. I'm the Student Recruitment Coordinator at the Michener Institute of Education. A very warm welcome to all of you joining our session today to learn more about our joint U of T MRS program. Here with me today is Teresa, and I'll pass it over to Teresa to introduce herself.
Good evening, everybody. My name is Teresa Dial. I'm the Admissions and Recruitment Officer for the Medical Radiation Sciences program at the University of Toronto. Thank you for joining us this evening.
Thank you, Teresa. Here with us today are some students in the program, so we're going to pass it to them to share more about their student experience in their specific programs. So before I start, I'd like to acknowledge the land we're on is Michener, on which the Michener Institute operates, has been and continues to be the traditional territory of Huron-Wendat, the Seneca, and the Mississaugas of the Credit River, among many other unnamed and unrecognized indigenous communities. Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibility of taking care of this land and transforming our personal and institutional relationships. We acknowledge that this is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's 7 health-related recommendations. So, what exactly are the joint U of T programs that we offer that we collaborate with University of Toronto? So, the first one is Nuclear Medicine and Molecular Imaging Technology. Nuclear medicine is an imaging method used to safely detect diseases in its early stages. The practice of nuclear medicine involves the use of radioactive tracers administered either by injection, orally, or inhalation. Special cameras, computers, and radioactive tracers are used to imagine how diseases or treatments alter organ system function. The second program is radiological technology, which is the production of medical images, commonly called X-rays, of internal organs and structures. They are produced by passing a small, highly controlled amount of radiation through the human body and capturing the resulting image on an image recording device. So the third joint program is radiation therapy, which is the treatment of cancer and other diseases using radiation. In high doses, radiation kills cells or keeps them from growing and dividing. Because cancer cells grow and divide more rapidly than most of the normal cells around them, radiation therapy can successfully treat many kinds of cancer. So these are the 3 joint U of T programs that we offer. In terms of academic requirement for nuclear medicine and molecular imaging technology, we require a minimum of 1 year university education with a minimum CGPA of 2.7 and a successful completion of one single semester course in the following prerequisite subject, which is biology, math, physics, social science, and grade 12 U-level chemistry or equivalent. In terms of requirement for radiation therapy is minimum 1 year of university education with the same CGPA 2.7 and a successful completion of one single semester course in biology, math, physics, and social science. And finally, radiological technology, also minimum 1 year of university education with a minimum CGPA of 2.7 and then a successful completion of one single semester course in biology, maths, physics, and social science. So now we're very happy to be able to invite our student, Caitlin, from Nuclear Medicine and Molecular Imaging Technology to talk a little bit more about her experience as a student in the program. So over to you, Caitlin.
Hi, thank you, Cherry. Good evening, everyone. Thank you for having me. So I am a second year student in the Nuclear Medicine and Molecular Imaging Technology program. And a typical day, I can start with that. So We have labs 2 times a week. When we're not in lab, we are in lecture. A lot of them, I'd say majority, are online. And so the entire program, it's like a good mix. It's hybrid. So in our lectures, we will be learning about how to use the instruments that we need for the diagnostic tests. We'll be learning about various strategies for patient care. And then also in our labs, we get to use the actual machines that we can expect to see in hospitals and in clinics when we're actually out working. One really nice thing about this program is we do get a lot of work experience. I'm in my second year, and currently, um, every month, for 1 week, I'm at either a clinic or a hospital. You would be choosing, and you get to see just what a typical workday is like. So after graduation, after you get your certification, you pass the exam, you would be you would be working like in a hospital or clinic, and that early experience of getting to work alongside certified technologists in the field, getting to meet real patients, it's very rewarding and it's a good representation of what life after graduation will look like. As for my favorite part of the program and what interests me the most, it definitely is what I just talked about with the clinical experience that you do get. I think of course, the labs are very fun. We get to work with patient actors, but just being out there in the field is very fulfilling. You get to know that you are actually making a difference in these people's lives. You're helping them get to get answers that they want and that they need. And I guess the best part of it is you can see your improvement. You can see how you're impacting these people, and it really is a great practice. And also, it's a good time for you to be able to tell whether or not this field is for you. I think something we can all appreciate when it comes to like college or university programs is we want to know that what we're learning is actually going to be relevant and applicable to the field we'll be working in later on. So that's something I really appreciate. And as for admission tips for prospective students, in your first year, and this will apply to rad tech and rad therapy as well, uh, some students can have difficulty with anatomy and physiology courses that we have in our first year. So I think if you are coming from an undergraduate degree background and you have taken those kinds of courses before, you can review those notes. Um, Otherwise, if you haven't, or if you've never taken an anatomy or a physiology course before, I think it's still like you don't have to worry. I come from a background where I don't have a degree, and I found that I was still able to comfortably like keep up with my peers. But I think it's just if that's something that you want to prepare for, I think that's a subject that I would recommend looking into just for ease of mind.
Thank you, Caitlin. Well, that's very informative. I will encourage everyone to leave all the questions towards the end of our presentation. After all of our students from different programs shared their experience, we have plenty of time left for a Q&A for our guest speaker to answer any questions that you may have. So thank you, Caitlin, again. Now we will move on to Sarah for radiation therapy. Over to you, Sarah.
Thanks, Cherry. Hi, my name's Sarah. I'm a second year radiation therapy student. So I guess a typical day for me, I actually commute, but we do have some students that live on campus or downtown. Um, this year, or this semester at least, I'm in 3 times a week usually, and then I'm online for a full day. And in first year, I think I was downtown for an average of 4 days, but usually not every day, which is really good because then you get time at home to be able to study, catch up on notes, that kind of thing, which I find really helpful. Um, Part of the in-person component are labs. So you actually get to use technology like the linear accelerators. In second year, you learn how to use the CT machine. In first year, you actually learn how to do venipuncture, so starting IV lines. And then also in second year, you get to do treatment planning, which is like a whole different software that you use to look at the CT images. So a lot of new stuff. It's always constantly evolving, so things are always getting updated at Michener too. As for lectures, they're kind of just as far as lecture goes. You're learning about the stats and the more like the methodology of doing things so that when you finally go to clinic, you have a good working knowledge and then you can really put it to use in person. So as for clinical, you get 2 months at the end of your first year, and all of your third year is at a clinical placement. Your classes are between Michener and UofT campuses because we're between the two schools. Most of your labs will be in Michener though because they're the ones that have the technology. There's also a lot of really cute cafes nearby, so my friends and I, we love to go study by there. You see profs all the time. It's definitely like a really good social environment, and so when you're downtown, it's especially if you're commuting, it can feel really far, but it has really turned into a good experience, which kind of leads into my favorite part of the program. It has to be the small class sizes. In my undergrad, my classes were typically like 1,500 people, so there was really no personal element to it. But then since coming to Michener, I think my year is about 60 people now. And everyone's very like-minded, has the same kind of passion and interests. So it's really nice to be able to kind of talk to anyone and have a very similar mindset, similar working knowledge, like where you came from before. It doesn't really matter the length of time that you were in school before. But it's kind of that like inward drive that really connects us all. And on that too, we usually like to plan outside of school social events. So the school will sometimes have like pub nights and that kind of thing to get people together. But we've actually gone off and done our own too, just because we enjoy hanging out so much. And the profs in particular are really great. So again, going from big class sizes to the smaller class sizes, I really wasn't aware of how well or how much better I could be doing when I have that relationship with my professors and they really get to know you and your strengths and your weaknesses. I would say it's definitely a plus to Michener. And as for the most interesting part, I have a super long list. I won't really go into all of them, but the field is always changing. You always have new machines. AI plays a huge role in our career. There's always new research coming out. So, like I said, Michener is always updating, but so is, the clinical advances and things that are outside of our school. It's not a desk job, which is something I definitely didn't want in a career. So it's really great to be able to interact with people, do some hands-on work, and every day is just so different. Every person is so different. Every case is so different. So if you don't really want a stagnant workplace, if you want somewhere that's always evolving, always changing, and very interactive, this is definitely for you. You also have a lot of interprofessional interactions. So we do a lot with doctors, nurses, surgeons, anesthesiologists, dietitians, social workers. You kind of get connected to almost everybody in the hospital. And there really is something for everyone. So if you like the CT part more, you can kind of lean into that. The treatment part, the surgery part, the planning part, the research part, like there is really just a niche for everyone within radiation therapy. As for admission, just be confident in what you bring to the table. Everyone brings a different background, different experience, different interests, different strengths, and each can contribute to the future of healthcare in a very positive way. And the interviews, if you get offered an interview, they can feel very scary. I think that was probably the worst part for me. But just take a second to reflect on questions, and just share your personal experience and your personal outlook. I would say that would take you very far.
Thank you, Sarah. Those are really good tips for our students, and thank you for providing so much information about your favorite part of the program. And we'll cover some of the questions if you may have regarding Sarah's experience later in our Q&A session. And then now we'll have Rachel, our radiological technology student, to talk about her experience. Over to you, Rachel.
Hi, thank you, Cherry. So like Cherry said, my name is Rachel, and I'm a third year radiological technology student. So in terms of like what a typical day would look like for me, so I'm actually on my third year clinical placement. So similar to what Sarah was saying, you do get at the end of first year, you have 2 months of clinical, and it kind of just gets you like a nice introduction to what it is you'll be doing in the field, like on a day to day. So a lot of it, especially in first year, it's taking X-rays, especially of more like simpler ones of just like your appendages, so like just like your arms and feet and your legs, things like that. But you come back again for the second year to enhance that theory. You learn more about like different types of imaging theory regarding radiological technology. So we go back, you learn about CT, you learn about interventional radiology, you learn about other procedures that you would take part in given your role as like a radiological technologist. So the entire second year is just full theory and curricula. And again, it's similar to what Sarah and Caitlin had mentioned, in which it's a hybrid and small groups of learning. So you'll come in, you'll get hands-on with the machinery, but you'll also be able to extend your growth academically with like the online modules and any online courses. But in your third year, where I'm at right now, it's just more or less like 8 to 10 months of just full clinical. So day in and day out, you're going in just like a tech, and you're doing the shift, and they have you in shifting as well. So you'll be working the full 8 hours in the day. You get your lunch breaks, you get your breaks, but you're basically working side by side a technologist. So it depends on the hospital, depends on the site. I'm personally at Oak Valley Health, Markham Stouffville Hospital. And the way that we do things there in terms of a typical day is that they put you in a certain area of the hospital. So like either the X-ray department, fracture clinic, emergency, and then you're not necessarily working with one technologist, you're working kind of alongside them, and they're just going to be able to watch over you and make sure that you're doing things correctly. And if you have any questions, you're like able to ask them. And if you have any kind of like suggestions or wondering why you would do things a certain way, you're always welcome to ask them, and they're always able to give their feedback. So working hand in hand and like side by side with the technologists day in and day out and being rotated throughout the hospital is like what my typical days look like these days. So you get a nice taste of what it is to actually be working as a technologist. And then, so right now we're kind of reaching the end of that fall semester, but then come winter semester in the new year, they'll have us doing rotations in terms of like the times of our shift as well. So we'll do like evenings and nights, and it's really just helping us to get kind of set in that role as a technologist if you were to work in a hospital. So my typical days just look like what a regular techs would in terms of taking x-rays, or helping out in like the OR, CT imaging as well. Yeah, just lots of variety. It really depends on the day, depends on where you are. In terms of my favorite part of the program, especially being able to put it into practice, I'd say I really like how you can act as the middleman between that patient care aspect and being that manager of the equipment, and like being able to use your instrumentation and what you know of it and setting techniques and things like that to get the best form of diagnostic imaging for the patient. And at many times, whoever you're imaging, it differs per case, but a lot of people or a lot of patients will need that extra care, and it's not something a computer can give them. So it's your role to be able to kind of help them out in that way, as well as being able to manipulate your technology in the best way to help with their diagnosis. And then in terms of what interests me most about the program is specifically how much you can actually expand in terms of your knowledge and where you are. So technologists can work in like varieties of fields. I think Sarah mentioned a few, like you can lean into different parts. So interventional radiology, minimally invasive procedures, like OR specifically, like C-arm equipment and work. It's just there's a large variety of things that like a radiological technologist does. We're best known for the X-rays, very, very famous for that. But you work very close with different types of machinery, like the CT, and like OR. You can be in like procedures, you can be hands-on in procedures and interventional radiology. So I really am interested in how much the program allows you to grow and branch off from kind of this basis point. As like a radiological technologist. And then any admission tips for prospective students, I'd say is just to have like a good idea of what your capabilities are and how you'd be able to apply in the workplace. So one thing that I kind of, or maybe would like to have known before entering the program is kind of how physically demanding it is. So like Sarah mentioned, like it's not a desk job. You're very much on your feet, moving equipment that's almost double your size, but it's important to work ergonomically in that sense. And you learn all of that when you're in the program, but just being able to apply your strength and your physicality towards your everyday work, I think it's something that you guys can like kind of think about or have in mind when kind of applying. Yeah.
Thank you, Rachel. That's a lot of helpful information, especially for tips and what to expect in the program. So right now, I'll open the floor for any Q&A you may have for our guests. Feel free to ask any questions regarding our guest experience, the program details, admission requirement. I will encourage you to put your questions in the Q&A section instead of the chat, so we'll be able to answer them live one by one. So I do see some questions in our Q&A. The first one is that we're wondering for each of the three programs, is a deep understanding and application of physics necessary? And also, is the learning more collaborative or more independent? Say like, are there group discussion, projects, assignments, or things like that? So I'll pass it over to Teresa to answer those questions.
Well, I think actually, well, one of the prerequisites, thank you, Cherry, and nice to hear from the students. So physics is one of our prerequisites to get in. You need at least one semester of intro to physics. But again, if you do have more than one physics, we take the highest one. But in terms of for the content of the curriculum, I believe maybe the students would have better insight, whoever would like to jump in and share with us how much physics have you used in first and second year, and even in third?
I can definitely speak on that. So I actually didn't take high school physics. In my first undergrad, I did have to take a first year physics, but that was more just like your basic physics, like forces and that kind of thing. Never my strong suit. I didn't ever think I was going to be going into a career that required physics. I will be honest that radiation therapy does require a lot of physics, but it's radiation physics, and it's a lot different, and they really start from the bottom and then build on it. Every single semester you're taking some sort of physics and they all differ in a little bit of a different way on like what you're focusing on. But you really start from like the basics so you can have a very low level understanding and you'll build on it slowly and everyone kind of catches up to the same pace. So you definitely don't need like an extensive background.
To add on to what Sarah said, my journey with physics actually nearly mirrors yours exactly. I did not take physics in high school. I took just the intro to physics in my first year at U of T. And I will just speak candidly, I'm not great at physics, that kind of like the kind of physics with forces. Um, I during my first semester in the nuke med program, it also starts from the ground up. I think on in our first lecture we were learning about like what a proton, like what a neutron is, like so very basic starting point. And then past the first semester, I actually past the first half of the first semester, you don't need to worry about physics anymore in the nuke med program. So yeah, so summary just it's very basic what you do need. The hardest part is just getting the physics prerequisite to get into the program, in my opinion, in terms of the physics side of things.
And I'm not sure if Rachel has anything to add. Thank you, Sarah and Caitlin. The physics is the prerequisite that everybody is missing most of the time. So it's okay as long as you, and like Sarah and Caitlin said, they both got admitted. As long as you have that intro to physics, that's the minimum. You need that to get in. So everybody has a different strength background. Like for some people, maybe anatomy is the weak point, physics for others, math for others. So you can definitely be successful and get admitted even if you just took the minimum intro to physics.
Thanks, everyone. And in terms of the learning modality, is it more collaborative or independent, you would say?
Well, we do have, it was mentioned interprofessional education. So every stream will have actually a chance to work with other students like in the MD program and physician assistant. So while you're working within your own cohort, you'll also be able to work alongside other health professions because it gives you an outlook on who you'll be working with in the future. I believe it's both. You're independent and collaborative because it is patient-centered. So you are going to need to learn to work with others and with other people. So I believe it's a mix.
Thanks, everyone. Another question is specifically about nuclear medicine. How many hour clinical placement can you complete by the end of the program, and how much patient engagement is there, and what proportion of the job is patient interaction or engagement versus operating technology? And do you perform patient history or assessment before the procedures?
I'm sorry, I can't give an exact number for the amount of hours, but I can just describe what it will look like in terms of the clinical placement. So in your second year, every month, you'll be at your site for nearly the full week. For me, it's 4 days a week, Monday to Thursday, and it's an 8-hour day. And then for your third year, like the other two programs, it's full time, also like 8 to 10 months, 8-hour days. I believe you can get the exact number on the nuclear medicine, like UofT and Michener program page. But yeah, that's the gist of it. In terms of patient engagement, there is a lot. I think, between operating the technology and then the patient interaction, I think it's like very equal. Just to give an example of what I do at the clinic that I'm at, we do cardiac scans. And so it's a pretty lengthy scan, could be around 3 hours. And so from the start, you're walking the patient in, and then you are getting their history. You're asking them relevant questions. You're explaining the test to them. You're getting their consent. And so this is a key time to be empathetic and listening to their experience. If they have any concerns, being compassionate. And even when you're positioning the patient for their scan and operating the equipment, it's good to answer or to let them know what you're doing, answer any questions they have, and also just check in to see if they're comfortable. So, in my opinion, it is a pretty fair balance between the engagement and the technical side of operating the equipment.
Thanks, Caitlin. I hope this answers your question. And then another question, what characteristics would make someone successful in this program or job? So I'm not too sure, Sarah, which program you're referring to, but I'll pass that over to Teresa.
Thanks, Cherry. So characteristics would be, well, you've to be really organized. There's a lot of things going on, I believe, in each modality. And of course, patient focus, right? You're going to be dealing with people, so those interpersonal skills. Professionalism is really important, and attention to detail, even when you're applying, the attention to detail, I can't stress enough, is very important. Not reading something carefully or making one small error while it's during the admissions process or while you're in your clinical or in your future job will make a difference between life or death. So things like that is very important. We actually have, and I know Cherry will mention it later, but recordings of our Meet an MRT webinar where each MRT talked about specific characteristics for their job. But Rachel, since you're in your clinical, do you have anything specific that you found to be very helpful?
Yeah, so like kind of just coming off the things you said, like being like detail oriented, but at the same time, being confident in what you're doing and being able to take the initiative, because like by the third year, you've basically learned everything that you need to know in terms of curricula. So the whole point of the clinical portion is to be able to apply it. So what I've learned or what I've seen is that when you take initiative on certain types of cases, it shows that even though you might be scared or it's something that you haven't done too much of, you're working side by side a technologist. So they're going to be able to help you. But it's that initiative, it's that like drive and that confidence to be able to take on certain cases and help out certain patients in certain ways. It's to be able to have that confidence and initiative while also keeping that attention to detail so that you're maintaining like certain practices like low radiation and things like that. So just being able to apply those characteristics, I think is really gonna help you in terms of the jobs and the program.
Thanks, everyone. Another question is whether you can pick where you do your clinicals. Over to you, Teresa.
So for the clinical placements, every stream has different locations. Could be anywhere in Canada. Radiological technology is mostly in Ontario, but it is a lottery system. It's unpaid. When you get to that stage, and the students, any details I might miss out on, you will be asked. Like we ask you when you apply, just for our own purposes. It's not going to affect if you're going to get an offer or not. It's just more for reference how many people are interested in certain sites. But you will get asked once you're admitted, and if your first choice is also everybody's first choice, I believe there's another round that you go through. To see who will rank, and if everybody still chooses the same thing, it is based on the lottery to keep it fair. Sarah and Rachel and Caitlin, I know you all are in clinical. Did you all get your first choice? I don't know if that's something you want to disclose, or was it a difficult process?
I definitely didn't get my first choice. I got my second though after reworking it a little bit. I think my first choice was one of the more popular ones. For the most part, at least in radiation therapy, everyone wants to be right downtown Toronto because that's where a lot of the newer developments are. I'm not downtown. I actually wanted Credit Valley because it's closer to home. I ended up getting Oshawa, but it actually paid off, I'd say, because the staff there was really great. I got along with them well. And I also was there with some of the girls in the program I met that I'm really close to now. So it ended up being a really positive experience in terms of like my relationships I was able to build. Um, so, kind of disappointing that I have to move away from home for parts of the year, but um, it's definitely worth it in terms of the experience that you get.
I got lucky. I did get my first choice. This is specific to nuclear medicine only, I believe. But as I mentioned, we have the part-time clinical placement in our second year, and it's spread out like once a week every month. But in your second year, for that part-time placement, all the locations, all the sites that you could choose from, they're all in like the GTA like area, or like they're like within like commuting distance. And so the school knows like if we don't want you to move away like just for like 4 days a week every month. So that's something that you wouldn't have to worry about for the second year because it's all like in the GTA for the most part.
Thanks, everyone. Rachel, would you like to add on?
Yeah, no, I got my first choice for my clinical placement, but I know that a lot of girls wanted it as well. So it was more so like if we didn't get it, we would get placed into a lottery. So when we first started, we ranked our choices, our top three, and then if it was still within the lottery, then we would re-rank, and then you would go into another lottery. So it was just a lot of like nerve-wracking, kind of just waiting to see what name is drawn. But I did luckily get my first choice because it's close to home. So.
Thank you. Another question for applicants coming from pre-health programs or adult learning upgrades. Are those courses accepted as equivalent? So Teresa is answering the question. Another question related to clinical placement in the program. Does the school arrange the site, or do students have to find them on their own? This was being answered. What are the current employment opportunity like in nuclear medicine? Are graduates generally able to find jobs quickly after completing the program? So over to you, Teresa.
So first, it depends on when you want to write your exam. So first, when you graduate, you'll have to pass the national exam. That's offered 3 times a year. I think most of you, because you end around April, will attempt the May exam. I know, Rachel, I've asked you this question previously. When are you going to write your exam? Because it's fresh in your mind. So you do get 4 attempts to do the exam, but I can't tell you, you're going to get a job 100% because it really depends on you. So once you pass and how you network and how flexible you are, I believe as Sarah mentioned that everybody kind of wants to work downtown Toronto. So, nuclear medicine especially, there is a need outside. I know that in Windsor right now, there's a huge lack, and you get signing bonuses. So it really depends on each site and each area and on the salary, or how many they're going to accept. But both Michener and UofT do help with with career fairs and helping you, with your resume and networking. So I believe you will be in good hands, and I have no doubt Caitlin will find a job when she graduates.
Fingers
Nuclear
crossed.
medicine, but I'm sure Sarah and Rachel have also very high prospects.
Thanks, everyone. Another question, was extensive experience like shadowing or previous volunteering experience in the field required for an interview? So over to you, Teresa.
So we don't, again, the interview, I just want to emphasize, so you do need to be invited to the interview. So after you submit all your documents, and that's worth 60% your academic. So should you be competitive enough after your CGPA is assessed, we'll invite you to an interview, and that's worth 40%. So it's 4 to 5 questions. And while we don't, it's up to you how you answer the question, but we usually look for your collaboration, your values, problem solving skills. Um, if you'd like to use an experience you've had in the past, whether it be volunteer or work, to answer a question if you find it applicable, that's up to you. But we don't ask for reference letters or expect our applicants to have extensive volunteer experience to be successful in the interview. I hope that answers the question. I don't know if the students have anything to add if you remember your interview at all.
Yeah, definitely. It was huge to me. I would say I didn't really have much like clinical experience or volunteer experience or anything like that. I really just applied out of my undergrad as like the next thing to do because I knew I wanted something in healthcare and something that wasn't sitting at a desk. Um, I remember the first question though, it had to do with diversity in Toronto, just because it is so diverse. And how do you promote that day to day, or how will you promote that in your job? And like I said, I think I mentioned it earlier, but when you're answering those questions, really just make sure to pull on your personal experience. Like for me, I have grandparents that immigrated here, and so we've kind of just been building generationally in terms of like schooling and that kind of stuff. And it's kind of I was able to kind of pull on that to answer the question, and I feel like those personal connections kind of probably played a really large role in my admissions. Because then you also have that empathy piece that goes along with that, and it's your personal experience, and you can relate to other people. And I mean, maybe Teresa could speak to that more, but I think that's really what they're looking for.
Thanks, Sarah. Just to add, when you do get invited to the interview, we'll send you the invitation, and once you confirm which date you would like and time you'd like to do your session, you get about a week to test the system and also to go through. There's a checklist you go through before you actually do the interview a week later, and there's sample questions. Well, they're not going to be the same question. Obviously, they're very, very similar to what you're going to experience the day of your interview. So it's hard to say don't really prepare, but prepare because you are who you are. And I'll tell you, it'll be obvious if you are going to memorize your answers, because people do that, and people will use tips, but it'll be obvious if your answer is genuine or if it's memorized or read. So just be confident, like the students have said, be yourself, because that's the point of the interview. We want to know who you are. So you shouldn't fake or try to be somebody different when you're answering your questions.
Thank you. I hope, Gary, this also answers your question in the chat about preparing for an interview. Moving on to another question, wondering if any of the students are able to comment on what a competitive non-minimum GPA is for the 3 programs. Would any of you be comfortable sharing or?
Oh, yes, I can just speak from my own experience. I just came from 1 year of life sci at UofT at the St. George campus. I'm pretty sure I had I think it was like a 3.1 going into applying to the program. I was waitlisted, however. I don't know if it was, or I guess I don't know the circumstances of why I was waitlisted, but I think it's just something to consider. But waitlisted or not, once you get into the program, you're good from there.
Kind of like I
Thanks,
mentioned before, physics isn't my strong suit, and they do ask for a breakdown of some of those core marks that they ask for. So definitely that didn't look great on my GPA when I had to type it out into a box. But I think my GPA coming in was a 3, 3.0. Um, so maybe just a touch over like the minimum, but I would say like even if you're at the minimum, just apply. There's absolutely no harm in doing so and trying it out, right?
Yeah, and myself, similar to Caitlin, like I had done 1 year in U of T Life Science prior to applying. And I think I had applied with like a 3.7. So, in terms of like the competitiveness and like what the admissions had said, so it's like minimum of 2.7. I like kind of just applied kind of just with confidence, just hoping for the best.
Thanks, everyone. I hope this answers your question. Another question is, which course count towards the social science requirement? Will an ethics, philosophy, religion coursework? So over to you, Teresa.
Thank you. That's a great question. And usually, the best way for me to answer that is if you send mrs.admissions@utoronto.ca an email with the course code, course link that has a description or even a course outline, because it's such a broad topic that anything that really relates to how an individual is affected or behaves towards a group setting beyond their immediate experience is what we look for. So the best way that we can confirm, so please email us so you can refer to the email as well for confirmation.
Thanks, Teresa. Another question for the U of T students who are accepted into the joint MRS program. What program or courses did you take before applying, and what pathway worked best for you? So if any of you would like to share.
Yeah,
I
oh, sorry,
Oh
you can
no, no,
go ahead.
sorry. Oh, sorry, thank you. But yeah, like the first year at U of T, at the St. George campus, I knew that the two schools were very close together, so I figured I'll go to U of T and get my prerequisites there, so then I can also just get used to like the university life in like the downtown core as well. And as for the courses I take, other than the prerequisites that were listed. I took a political science first year course as well, like that, because that's what I was interested, and I found that worked out for me. Just when it comes to the prerequisites that are a bit more broad, where you can choose, then yeah, of course, just choose something that you are interested in.
So I did a 3-year BSc at Western before applying to Michener. So I was technically in my graduating year. Um, I took honestly a whole ton of courses because I switched my major a number of times. Like I started in medical sciences, I tried some genetics, and then I actually took a medical physics course, which was more kind of about like imaging and that kind of thing. And I think that's what really piqued my interest. That was in my second year. And that kind of got me thinking in my last year about what I want to do after that. Um, I guess I didn't really like I got a Bachelor of Science, so I took mostly science courses. But I also like psychology, so that was kind of like my social science component. I did want to speak on this though, because we do have students who in my cohort who came actually from music backgrounds. And we also have someone from a business background. So it's definitely not exclusive to sciences. I'm sure they had to take the prereqs at some point too, so some sort of science in there, but it's not just exclusive to science either.
Thanks, everyone. Another question is about preparation for interview. We've covered that already. And another question for the guests or panelists, why did you choose the profession that you're working towards? And what is something you learned about your profession that you did not know before entering your program? So great question. If anyone would like to share.
Well, I could answer that question. So I chose to kind of pursue the route of like being a rad tech is because I knew I wanted to work in a hospital, but I didn't want to be like a doctor or a nurse, which are kind of the big profession that you always hear about. But behind the scenes, there's so many other people who are working in the hospital to help towards people's care. And so like after doing even just like a little bit of research, I found like this program. So like rad tech, rad therapy, or nuclear medicine. Like given the three and reading like the descriptions, I kind of just went for rad tech as the kind of as the go-to, just because of more so what they do on the day to day in terms of like being able to take x-rays and their forms of patient interactions. But just being able to work in a hospital or like work in healthcare and being able to contribute to someone's like pathway of care, like you're contributing to their diagnosis. So that's kind of why I pursued kind of the program. It's like you're not a doctor and you're not a nurse, but you are still a part of the patient care aspect. You're a part of like bettering that patient's like overall care. And so I thought about that in mind when I was kind of looking for the profession. And then in terms of something that I learned about my profession that I did not know about before was, like I kind of mentioned earlier, is like the branching that you can do from it. So there's a specific scope like under rad tech, it's interventional radiology. Only after doing kind of my clinical rotation in it for a few weeks did I find that I am very much interested in it. So it's like you work like side by side the radiologist, like you work hand in hand with them as they do like interventional procedures. So just like inserting very long lines and picks through like intravenous and vascular access. And you're using a lot of imaging because you're performing minimally invasive surgeries without actually opening up the patient. It's just like a little slit, little hole to let all of these like wires and things through, and they really rely on the diagnostic imaging of like fluoroscopy and x-ray to be able to see that. But it really does make a lot of changes in the patient's lives and how they kind of go about their day to day. So I didn't know about that kind of when I started the program, but seeing it live and helping out the radiologists and being able to see what their day to day looks like, I was like very interested in it. So
Thanks, Rachel. Another question, wondering if students in your in nuclear medicine program can join any research projects or work with faculty on research. So perhaps Teresa or Caitlin.
There is a research course that you can choose to take, Caitlin. I'm not sure if it's been offered yet for you, or if you decided to take that route, or if you'd like to expand on it. And I'll look up the semester list. If you just give me a moment, maybe while Caitlin expands on the answer.
Yes, I was also going to mention the research course that's built in as an option in the program. I believe that is for the third year, I think, or it's like starting at the end of second year.
I'm just going to provide the link if you don't mind. Maybe go to the next question and I'll type the answer for the nuke med research.
Yeah, thanks, Teresa and Caitlin. Next question is whether the person has a good chance of program entry with only 1 year of undergraduate studies. So, Teresa.
Yes, I mean, Caitlin and Rachel are examples. At Fall Campus Day, we had two students as well that got in within 1 year, and it can vary from life sciences, kinesiology. It really depends. The reason why first year might be a little intimidating is just because you need those four prerequisites, but it is definitely doable. And in each year, more for students in first year apply and do get admitted because you hear about it more. So, but I also like to say if it doesn't work out when you apply in first year, please just make sure you have a backup and you choose a program that you know that you're going to continue in second year. So if you bank on I'm only taking this first year course to get into MRS, it's not always the best decision, but to choose a program that you like and you enjoy. But yes, it's possible.
Perfect, thank you. Is there a maximum amount of students accepted into each program, and is it different for each program?
Typically, it's a great question that we do accept 120 students a year. So for radiological technology, it's typically 40, radiation therapy, it's 56, and nuclear medicine, it's 24. So last year was different. We had the greatest number of applications, and we took more people for radiological technology to 52. And that's always dependent on funding we receive from the government. So, and the amount of clinical sites that we can offer. So is typically though, it's those numbers each year.
Thanks, Teresa. How do you choose the stream over the other, and what are the considerations? So over to you, Teresa.
So you can only choose one stream when you apply. And on your checklist, there's a mandatory checklist you have to fill out when you apply. You can choose a second choice. It has happened in the past where we've provided alternate offers of admission. So if we can't fill the seats for one program and we've gone through the wait list and we can't fill it then we go to the people who chose it for their second choice and ask them, are you willing to consider this program over your first choice since we have a seat available? So that's the reason why we ask that question. But once you apply, typically that's the program you are going. If you accept, that's it. You can't switch once you accept your offer. And that's why it's considered a second entry, because with other MRS programs in Ontario and Canada, they might not specialize right away, but we do because we want you to be sure and we want to teach you exactly what you've chosen. So things like the open house and events like this really help applicants prepare for which stream they'd like to commit to.
Perfect. Next question is about the number of online classes that you have in first year.
I'll let the students answer that one.
From what I remember in first year, I think there were at least 2 days out of the 5 day like school week where it was all online. And then in my experience, and then in second year, there were even more days online. So like currently in this semester, I should say, I think it was only 2 days of the week where I had to be here on campus in person.
Thank you, Caitlin. Another question, calculus is a prerequisite. How much of it do you use in the three programs? So I'll pass it over to our student.
In Nuke Med, I think the most difficult math we have to do is around the grade 10 level. So if calculus isn't fun for you, then you don't have to worry.
In radiation therapy, we don't have like a math course. I guess the closest thing would be the physics course, because a lot of it is calculation based, but half of it's also theory. So it's no calculus. It's a different type of math, but it kind of goes more like theoretically, I guess, with diagrams and beams, if that makes any sense.
And for radiological technology, similarly to like Sarah and Caitlin, I'd say it's more so like theory. I think maybe like grade 10 or 11 math is more so what you'd be using. And again, it's more so for theory, even in like physics or even like the instrumentation. But even then, so it's on a day-to-day, truly, it's minimally used.
Perfect. Thanks, everyone. What's the competitive average of each prerequisite course? So over to you, Teresa.
It's a great question. While we don't have a minimum grade published for the prerequisites, we do recommend that it's 60 or higher or to be competitive, because a pass or a credit, no credit course, we found it's not as competitive. But again, the higher the better is what I always say. Can you get in with not so high prerequisites? Again, it depends on your overall CGPA and your prerequisites average. So I believe there are many questions about how it's calculated, and it's a great question. And I just want to confirm that it's based on two averages: your academic score, your complete CGPA, full undergraduate studies, whether it's to 1 year, 2 years, or full undergrad, the average of that plus the average of your top 4 prerequisite marks.
Perfect. Another question, can you go into RT right after high school?
Unfortunately not. It's a second entry professional degree. So when we say second entry, you need to have at least 1 year of university studies, because this program is actually a 4-year program condensed into 3. So if you hear the term direct entry, that means that you can apply from high school. But when you hear second entry, like other programs at U of T, it's at least 1 year or more of university studies before you can be eligible.
Perfect. And thanks, Rachel, for the answer for nuclear medicine and radiation therapy. What did you choose? Why did you choose the profession that you're working towards, and what is something you learned about your profession that you don't know before you entered your program? So I believe this was being answered earlier. Another question, I entered York as an ESL student and completed the required English test at that time. Now I'm in my second year. Do I need to take another English language test for the program, or will my previous result be accepted? Over to you, Teresa.
I'm just going to send the link to U of T's English language requirements to answer this question.
Perfect. For all students, have you encountered any challenges or difficulties related to patient care, and how did you learn to handle these?
I wouldn't call it a challenge, I guess, but you have to keep in mind that a lot of these times, these patients that you're interacting with, they're in hard situations. You know, no one really wants to be in a hospital. So it's just always having that kind of empathy mindset and working with them because typically, if there's an issue, it's not so much with you or whoever they're having an issue with. It's more just the more general fact that it's an unpleasant situation for everyone and there's something that needs to be addressed in terms of patient care or they need something else. They need more accommodation or whatever it is. So I would say part of that you also learn in like patient care in your courses. And part of it is just practice too. You're not going to be perfect at patient care when you first start. I'm definitely not. But you practice it in school, and when you get to clinic, you practice that a lot more, and it becomes easier as you just keep trying.
Thanks, Sarah. Would anyone else want to chime in?
Yeah, just add on to what Sarah said. Yeah, just I think just having compassion is a big thing. Like anyone working in healthcare, I think we are prone to burnout. But I think that learning strategies to cope with that, and then also just I think trying to have the mindset that you went into the field with, and keeping like that level of empathy and just um, knowing how to take care of yourself first and foremost, so then you can then take care of other people. I think that's something important to keep in mind.
Thanks, Caitlin. So we're being a little bit more mindful of time. So one last question about where the clinical sites are at. So I'll leave that to Teresa.
So it can be anywhere in Canada. And again, different streams have opportunities in different areas. On our website, on the different program pages, you will see like radiation therapy, for example, will offer maybe out of province. And also on our sample checklist, you can see that people can choose like a preferred site. So we have sites in London, Sudbury, Windsor, Ottawa, Peterborough, GTA, Markham, Waterloo. So it's everywhere, Saskatchewan, and so on. So I'll provide the links. So just in the chat so everyone can see of our each program page and you can see the list of the clinical sites. Not all of them, but some of them are there.
Thanks, everyone. So this concludes our live Q&A session. For those questions that are not being answered, we do have members who are typing the answer, or if they're not answered, feel free to email mrs.admissions@utoronto.ca. That's their contact mailbox. And they also have drop-in Zoom sessions every Fridays from 12 to 1. You can ask questions and speak to the MRS admission team one-on-one. So to address any specific admission requirement questions related to the MRS programs. They also have a recording to meet an MRT recording, which you can refer to on the website, which will be helpful for you in case you're interested in the program. And finally, before this session, we did have a few other series of Korea topic related sessions for our Michener program that are non-joint UofT programs. So if you wanted to refer to those other programs, feel free to go into our michener.ca website for the recordings. So thank you everyone for attending today's session. And I hope you all have a wonderful evening. Thanks everyone.